who is online, who has access information, how long the people have access information, both from the staff and the student side. The other issue that we need to be cognizant about is it's the mode of teaching and learning that has changed from face-to-face to online learning, e-learning. For e-learning, there must be materials available. Someone has to provide those materials. There must be lecture notes available. There must be other support available. Consultations must still take place. So the support structures of our university doesn't just vanish. It's not that the student sits there and it's totally, the student is by hers or her own, left to herself and so forth. The first action that we have taken is we have engaged our internet service providers in terms of the bandwidth, which will be one of the issues that we have to address, as well as the issue of the data. And I must confess that the bundles that some of the internet service providers are willing to provide is sufficient for students to be able to access. We are planning to see how best we can assist students pertaining to the bandwidth. In terms of the issue of the devices, that is an issue that we need to carefully see how best. We know there's a challenge, but we need to see what is the best solution to this issue. Something that is actually, in other parts of the world, you will notice that when you engage in this kind of learning, you need to have computers, laptops and things like that. It's something that we have to earnestly discuss and come up with different strategies how to deal with that. The institutions will provide detailed information. Private higher education institutions, we have platforms that we are constantly engaging with them. In terms of student funding, we are unpacking, you know, it's a new financial year.
Yes.
We have just started uploading the systems and the process of, because it's an emergency. We need to really come in during this time to support the students. We have different strategies that we are thinking about. In the past, it took some time to release the money, especially the tuition part for the private higher education institutions, as well as the public higher education institutions. If we can manage to release the first portion during this time, remember we are only 1 week into. Sometimes we lose touch of that. We're talking about 1 week. The plans that we are putting in place is if we extend it after the first 21 days, maybe 30 days, what is it that we will have to do? That's what we are looking at. Our student funding institutions are ready to support both the students as well as but the modalities we have to discuss.
Thank you.
Thank you very much.
Thank you very much, Dr. Van Kent. Dr. Mowes, what has been the experience of NUST as soon as the confirmed cases became a reality in Namibia?
Thank you so much, Honorable, and thank you so much for the opportunity as well. I'm of the opinion that this is a platform where we can share with the nation what we have done so far and where we are heading towards to address and minimize the impact of COVID-19. Just the setting that we have here right now is an indication for me of our coherent, unified leadership, and that's what's most important, and that's our starting point for me. Because if we don't stand together as a nation and involve all key stakeholders in education, I cannot foresee how we can mitigate the circumstances that we are currently in. So from NUST side, and in my opinion, as the ED also alluded to, and the discussions that we had yesterday, we have 3 scenarios. COVID-19 is here. We can risk our health and we can continue as usual. That's not an option. The second scenario is we can secure our health and we can stop education and halt it 100% till we believe that everything is in place. Again, in my opinion, that is not the option. Because when we talk about crisis management and crisis leadership, it's all about the good for now is the best, instead of waiting for the perfect solution and lose a lot of time in between. So the third scenario is, like the ED also alluded to, we have our restrictions, we have the regulations that has been promulgated that we need to adhere to. That put aside, what are we going to do about education? We have systems in place. For the past 30 years in Namibia, I'm being part of that for 28 years, we are using open and distance learning. And from the time that I can recall in '92, when we went to different areas in the country to deliver open and distance learning, from the most basic way, it was always a case whereby our students, our nation was, I would like to say, hungry for knowledge, for education. There was a chapter where our people were denied education. I don't believe that anyone in our nation can be of the opinion that we must move back to that chapter. We left that chapter. It's time to move on. I would also like to believe, as a nation, as humans, we are powerful beings. And when we put our mind to something, we can do it. So coming back to NUST, how we can intervene to curb the disruption in education. For the moment that the state of emergency was announced by our president, we basically, our first priority was with regard to the safety of our staff and our students. And it was for us immediate action to get our students off campus and to look after that their safety. Similarly, with regard to staff, we immediately started practicing social distance. So we continued working, but in our meetings it was either online or in big venues where we could practice what we are practicing here today. And then when we went on the earlier recess and midterm break, we started planning, and we launched a survey whereby we had to look at what is exactly the situation on the ground. Because we were, just before that, still in, a situation whereby everything is normal and we can continue. So we had to reassess that. And maybe I can just give you quickly the figures with regard to the survey that we have launched and where our students at NUST are currently. So we have a student population of about 12,800 students, and they're scattered across the country because we're a dual mode university. We offer conventional education in face-to-face mode, and we offer distance education. So coming back to distance education and online learning, just before I give you these statistics, we have structures in place that is internationally recognized, where quality assurance is in place to deliver quality distance education through this mode of learning. So we don't have to start from scratch. It's all there. We just need to roll it out to a bigger community, provided as we are taking hands with our line ministry, as we're taking hands with the National Council of Higher Education, the NQA, the regulatory bodies, and the investment that our government has already made for many years in this mode of delivery. We are together on the stage when it comes to leaders in open and distance learning. So with regard to the survey that we have launched at NUST about 3 weeks ago, we had almost, when I looked again at the statistics last night, almost 7,000 students responding. Majority of those students are actually not our distance education students, meaning it's this group that we need to cater for now, our conventional face-to-face students. So, like I said, yes, 7,000 students responded. 91% of those 7,000 students said that they have smartphones. 74% said that they have a laptop or a PC, And then 27% said they have no device. So we are realistic. We are mindful of our mandate that we need to be inclusive and we cannot leave students behind. However, we also cannot wait till everything is 100% in place. So we need to make provision for that 27% students who don't have devices. When we look at how our students access our e-learning platform, which is basically a platform for the sake of the rest of our nation, it's a virtual environment that is basically like a classroom. Everything that happens in a classroom can happen in that virtual environment, and they can have discussions with their fellow students, they can have chats, they can interact and engage with their lecturers, provided the device is there, the internet is there. We need to, for example, also look at solar charging stations for our students who don't have electricity. There's many means that we can go around to make sure that we put everything in place. With regard to access, we, for example, at NUST, we stopped teaching and learning for the interim because of this planning that we need to do. And from the beginning of the academic year, 93, almost 94% of our students, 93.8%, they do have an active e-learning account, meaning it's not something new to them, because many of our institutional core courses are fully online, and they are exposed to that. All our students, unless they're in a STEM area, they need to do computer user skills. That is offered online. They need to do information competence, which expose them about internet and how to use the online resources, and that is offered online. So the majority of our students, all of them have accounts, but from the beginning of the year up till now, 94% of our students were actively involved in our e-learning. And then, despite the lockdown, for the past 11 days, despite the lockdown, despite the fact that we said no assessments, we stopped teaching and learning in the interim, we will adjust our academic calendar so that they don't lose out too much, and we can do it in such a way that we take away the 3 weeks of exams and rather move towards continuous assessment to make sure that we still stay with the 14 weeks of teaching for the semester, and we continue the second semester with the adjusted academic calendar, but we don't have recess for the second semester. Yes, so for the past 11 days, 57.9%, almost 58% of our students, basically, say 60% of our students, were still active on that online platform.
Thank you very much.
I can come back later to, when we engage the questions about other specific matters and strategies that we have put in place through our Department of Information and Communication Technology to make sure that though students and staff are not on campus, they can access our network on campus through the virtual private network that's been the VPNs that's been made available to them.
All right. Thank you very much, Dr. Mowes.
Thank you, Honorable.
Dr. Beukes-Amis from UNAM, just really being a university with quite numerous campuses. Of course, you have quite a big number of students who still depend on the face-to-face interface to be able to gain their learning and education. What interventions has you now put in place, and what are the future plans for that?
Thank you so much. Good morning, Namibia, and everybody listening to us. I couldn't agree more with the ED in terms of COVID-19 and the crisis that we are facing through this pandemic. It's a disruptor, but so was ODL. Open and distance learning is and was always a disruptor as well. And it's very interesting if you look at the fact that social distancing is one of the measures that we can apply in order to curb the spread of this virus. How better or else would we be able to do it unless we go online? So the University of Namibia is definitely fully ready for this. We have ample years of experience in this regard. But if we want to go to specifics, we can specifically say that since 2016, the University of Namibia went fully online with all its distance learning assignments, activities, online facilitation of the learning process of our distance mode students. Because as distance mode students will know, as I'm speaking here, the learning of such a student is only best facilitated through feedback and interaction. And that's what we have availed. But needless to say, we have also, since 2018, went completely online with a lot of our core university modules, such as contemporary social issues, over 7,000 students fully online as we speak, English for communication and study skills, over 3,000 students online in that core module as we speak, and several others. I've only mentioned a few. So this is commonplace for the university. There was really no need after the university management and all its stakeholders met about the impact of COVID-19. There was really no need for us to basically put a pause to our learning and teaching process in terms of continuing with it. But we used a 2-week period in terms of our midterm recess, but also extended it with another week in order to prepare ourselves fully for this. But as I said, it was nothing new to a lot of our face-to-face community, our students that have not been so fully online before. So we managed to basically look into load management of the system. How many students will we be able to accommodate? How many lecturers will we be able to accommodate? We also simultaneously, and please go to our university website, we simultaneously developed a COVID-19 response website of the University of Namibia. And through that website, we have decided to teach and for our students to learn remotely. So there are a lot of avenues, a lot of tips and tricks, a lot of softwares that people, our students and our community at large can download, look at videos in terms of how to use it, how to capacitate themselves. So not just a matter of move online into our platform called Moodle at the moment, but also use other avenues such as the COVID-19 website that we have prepared. So yes, we're ready, we have the expertise, we have the confidence, we are there to assist our students. We're not going to leave our students on the wayside during this crisis. But hang on, colleagues, why must we do this? If we stop learning and teaching now, it means we will also not be able to reignite our workforce with the fresh candidates, graduates that we need as medical doctors, as accountants, whatever the case may be. This is the reason why we have to pivot our learning online just in a slightly different way from before. But as I was reflecting about coming here, I asked myself the question, what is it that our students feel that they really miss out on? And I was thinking, there could be a lot of things that they are thinking about and avenues that they are thinking about. But did they think about the fact that if we were not fortunate to pivot things online as we are able to do now, that even during a face-to-face scenario, if you would have missed a class before, you missed it completely. You hardly can catch up with that. But if that class or that recording of that lecture is now availed online, it means through the flexible means that this mode of learning is availing to us, you have more and more opportunity to go back to missed out opportunities. We don't want our students to fear assessment. It is part of testing your learning. It is an integral part of your learning. It's just going to be done in a different way. We are also not going to say, because we've heard lots of questions and cry-outs and fears out there about students saying, but lecturers already started with online tests and they've already started with assignments and this, that, and the other. But the university is committing to say, yes, we have moved on. We did not need to stand still during this time. But we are also not saying that those will be the only interventions that will count towards your continuous assessment. It is important that our students move online, that they do engage in this assessment activities, because what if COVID-19 is forcing us to extend lockdown? Then it means we have to hold hands, get together as a higher education community and make sure that learning can still continue. We have to make sure that we can promise our stakeholders that that product will still be the same quality product, whether through an online system or whether in a face-to-face scenario. We should not think that the one is less than the other. Certainly not now. Quality is enforced through all the processes that we engage in, even in online learning. Yes, let's come to access a little bit. The university is also fortunate that we have been using 3G and now this year 4G devices for the past 5 or 6 years already. Yes, we hear students are saying those are not working in all areas. Yes, we know the coverage of MTC and telecom, and where it is 2 gig that's available, or where it is 4 or 5, 3 or 4 that's available in major towns and cities. But it's for reasons like this that the university did engage with the industry through our line ministry, through our NCHE, National Council for Higher Education, and other partners as well, so that we can reduce pricing in this regard. But it's really not the first time for the university to avail this type of access to its students. We have been giving it for the past 5 to 6 years. And now more than ever, we went to step up from 3G to 4G devices. And students can actually use their SIM cards in their phones to make it a hotspot in order for them to be able to connect with their laptop devices or tablets or phablets or whatever device they are using. But I also want to, for interesting sake, just mention we've carried out a survey on Moodle in terms of the number of users and the most preferred device. And as we speak, 42,000 of our entire community, that's across face-to-face, distance, online, blend, our facilitators, our face-to-face tutors now online as well, over 42,000 accessed Moodle from a mobile phone. And that's the beauty of Moodle. It has a mobile app. You can download it and you can access your learning from that perspective as well. We do want to advocate for a laptop because we do want to have proper assessment going this route. But I also just want to, in my final statement, we can always engage more with whatever you still need from us through the questions from the audience and the Namibian nation. I just want to mention that we should not underestimate the power of learning analytics through our systems. You know, there's a fear, and there's always been a fear, where lecturers would say, how would I know whether my students still attended 80% of their classes as per the university rule and regulation? Or how would the supervisor know whether the lecturer has actually facilitated the learning as should be? You know, the learning analytics of our learning management systems, and any system for that matter, is so advanced at the moment that you can trace all these statistics. You can actually see the performance from login, what that person actually engaged in on the platform until that person logged off. And even if the person was only a lurker, as we would call it in our terminology, just sitting there doing nothing, watching others, even that we can see. So there shouldn't be a fear for our students or all our lecturers that are working around the clock to make this learning flexible and feasible for all our students. And I must say, I've heard the problem about practical subjects. We have wonderful examples at UNAM. Yes, they're a problem, and of course we have interventions and strategies to actually get back to those practical subjects. But hang on, you should see some of the simulations, some of the recordings, some of the innovation that these lecturers of us are also engaging in, whether it's from the School of Medicine, the School of Pharmacy, the Science Faculty, Education, Humanities, it doesn't matter. These are the times we are living in, and we need to allow our colleagues and students to embrace what is available to them at the moment. I thank you for now.
Thank you very much, Dr. Amis. All right, viewers, we are halfway through our broadcasting to ensure that you get your queries across and questions answered around higher education and the impact of COVID-19 on that sector. I now give the opportunity to the media practitioners here to ask questions to our panelists. I'd like to implore you to please keep it short because we do have limited time so that we're able to get the proper responses. Any? Yes, 1, 2, 3 for now. Yes. The mic is behind you.
Good morning, Jemima Beukes from Namibia Media Holdings. I do not see anyone from the Ministry of Health here, but I have a question.
Okay.
So the question is, can government confirm whether there are indeed 3 NDF and AWIN members quarantined at the Eros airport?
What? I didn't get that.
You didn't get it?
Yes.
Can you hear me
Can
now?
you just repeat? We didn't hear properly.
We understand that there are 3 NDF AWIN members quarantined at the Eros airport. Can someone just confirm that, please?
We'll get the Minister of Health will be here to answer that.
Okay. Then NUST yesterday said they do not agree that online education should continue. Even one student cannot access these online or these virtual lessons. From the presentation from Dr. Beukes-Amis and Dr. Mowes, it is definitely clear that some people, someone said 60%, that you've seen that 60% of your students have been able to access, meaning that at least 40% do not have access to internet. Is that how I understand it? Either way, if that is the case, what do you make of what NUST say? Do you not think it's fair what they say, that some people cannot be left out because only a privileged few can afford to access these opportunities? Thank you.
Thank you.
Good morning, I'm Delvaline from Eagle FM. I just have 2 questions. One is also for the Health Ministry and another one for the Executive Director, Doctor. My first one is that the Deputy Minister of Health yesterday, Dr. Esther Mnangagwa, said that of the people who have been quarantined, 7 are showing signs or symptoms of COVID-19. Now, I want to know whether they have been tested and also when these test results will be made available. And then secondly, my question is to the Executive Director for the Higher Education. Doctor, there are institutions, private institutions, that are asking students to pay or to settle their fees, yet there has not been any engagement with regard to e-learning or how they're going to be catching up or how they're going to start or for teaching and learning to continue. What is the ministry doing to also regulate this part so that students are, number one, not being, there's not anything, they're not being basically short-handed in the situation. And also, what are the regulations? We see that the government institutions are making a point to continue learning and teaching. What is the ministry, as the line ministry, also doing to make sure that in the private institutions are also doing the same thing? Those are my 2 questions for now.
Thank you very much. Last one, ma'am.
Good day. My question goes to Mr. Van Kent. Yesterday, the ED for lower education showed us the intentions they plan to take going forward in terms of teaching and learning. Can you perhaps share with
Just
us
move closer
what
to
you...
the mic.
Sorry?
Yes.
Can you perhaps share with us what intentions are in place to ensure that VTCs are also going to continue, because we have not heard anything in that regard? And perhaps to Dr. Amis, could you please share with us how UNAM plans to make sure that students, for example, vets, medicine, nurses, actually can do their practicals, because now there's this social distancing issue. Of course, you have spoken more on how you guys will take it up regarding theories. So in terms of practicals, to practice for the real world. Thank you.
Thank you very much. Questions around online access. Some can access, some cannot. How are we going to balance that?
Yes. Thank you, Honorable Deputy Minister. I must confess, in my introduction, I've stated that we have set up fora for both public and private higher education institutions. I've also indicated that a number of private higher education institutions are really far into, or are already practicing e-learning, a number of higher education institutions. What we have done as a ministry is we are bringing these two groups together. They are working together. There are examples of institutions sharing in terms of, both in terms of facilities. They are looking into sharing materials, sharing all those things jointly, even teaching each other how to do these, how to upload, how to, it's a learning exercise. It's an opportunity to extend access. So that is actually constantly taking place between the two groups, the public and the private higher education institutions, because we are in the same game. The second thing that we need to do is you see, the private higher education institutions are different because their revenue streams are different. The bulk of their operations is sustained by student contributions. While in the public higher education institutions, it's slightly different. The government is also supporting these institutions. So we need to actually understand those two different models or modes of operation, and we need to see how best we can support the private higher education institutions. This is an ongoing discussion with the private higher education institutions. I've said to relieve the pressure, the financial pressure that might stem from the initial lockdown, we have indicated to them that we might consider looking at the issue of advancing the first tuition fees to them, to support them, to carry them through this time. In terms of so that is about the private higher education institutions. It's an ongoing discussion. The rescue package that was announced by the Minister of Finance recently has also one component. There are different elements if you analyze the rescue package. They are for the smaller businesses, Those kind of packages can be suitable for institutions like the smaller private institutions to access these, to beef up their systems and so forth. They can do that. But it's something that we have to join hands with our private higher education institutions to see how we can carry them through this particular time. In terms of the VTCs, yes, there will be a separate session with the VTCs. It is true, as Dr. Beukes-Amis was saying, there are different options that we have to look at when it comes to the practicals. You have simulations. I've gone to the medical faculty and I've seen how they use simulations in the medical school to teach in the absence of maybe the cadavers and so forth. How do you do the same thing? It's a new environment for us. It's a learning environment. I've seen some material in the East being developed to teach TVAT using simulations. But it's not, sometimes it's always better to feel and touch things. But we are now in the first couple of weeks of this pandemic. We need to understand that we don't know what will happen in the future, but we are trying. We have the impact. We know that this virus can grow exponentially, but you can see from what is happening, social distancing does have a positive impact. So we should really work together and make sure that we really beat this virus.
Thank you very much, Dr. Beukes-Amis.
Okay, I will tackle the non-so and also the practical ones. I guess those two were directly, to us from the higher education institutions together with our ED from our line ministry. It's interesting that there is a feeling that maybe we are not thinking about all our students during this crisis moment. As one student is important to NUNSO, so is that student important to all of us. We want to reach the unreachable during this time. There is no way that we want to leave a single student behind. But I want to sort of ease off a particular fear. I think we are forgetting, colleagues, that we have already covered 50% of our face-to-face work prior to COVID-19. We are not starting from scratch. We are extending, we are complementing, and we are moving forward. 50% of our practicals, of our teaching, of our assessments were already covered prior to COVID-19. Now is the time for us to make sure we can take this successfully forward and make sure we do that with each and every student. I think Dr. Mowes mentioned it in our ED. It's definitely true that there will be challenges, as like with any crisis or pandemic. We certainly may not reach everybody at the same time, but we are surely not going to leave our students in the dark. It's important for our universities that students who feel that their circumstances do not allow to access because of the village or the scenario where they are coming from. We are carrying out these surveys. Even the University of Namibia is carrying out its own survey as we speak through SMS, as well as on social media platforms, because we want to find out what are the circumstances of each of our students within the University of Namibia. And they have the right to come to us and ask us, and the university is ready and flexible in terms of alternative assessments for all these students as well. Sorry. So we are ready in that regard, and I want to lay off that fear. Then just the question of the practicals. Apologies for my sore throat, but looks like we can handle it with the water. As the ED said, yes, I've already answered that by saying we will take a different stance and an alternative route with our practical courses for nursing, for medical doctors, whatever the case may be. But we are also already blessed with a lot of innovation in that regard through simulations, through a lot of recordings. You know, I always say this when we train or when we advocate for online, for its uptake, because there's always resistance, isn't it? Whether now during COVID or before. During COVID, it's availing us more of an opportunity because it's almost as if we are all forced now to do it. But before, there was a lot of resistance. But if we ask ourselves, how much impact do we really make during a 45-minute lecture face-to-face when we teach a class of 700 plus students? Do we really make the desired impact in terms of Bloom's taxonomy, hitting all those layers, you know, that we need to expose our students to? Couldn't have been a better time for all of us to halt a bit, to reflect, and to take our institutions and the entire higher education sector into another direction. Higher education has changed for us now, and it will be like this continuing going forward.
Thank you very much, Dr. Mowes.
Thank you so much, Honorable. From my side, and you know, representing NUST here, in our context, we have the majority of our study programs in our Faculty of Management Sciences and our Faculty of Human Sciences already delivered through open and distance learning and e-learning methodologies. So that is already developed, done, fully quality assured, self-instructional material that as we speak, we can just release to the full-time students registered for that program, for those programs as well. That's more than 50% of our student population that studies through those two faculties. So the approach is to keep with the traditional distance education, but also to make that self-instructional material already developed available fully online to students. And you know, when it comes to the practical side of our STEM programs, where students, you know, study science, technology, engineering, and the mathematics fields, the idea is that, and we know that can work because it's also a mode of delivery that's already employed at NUST, is that as soon as we are in a situation where we can have small groups of students coming to a venue, practicing social distance, that we attend to the practical side of it through block delivery. And within a week, the students cover the practical side. However, we continue with the theory side now through our existing practices of distance education as well as online learning. But then I would also like to share with you a very, very successful story with regard to our paramedic students, our emergency medical care students. We all know a very practical program. So about 3 years back, we implemented an iPad project amongst those students. We first piloted. It was a huge success. Students loved it. Then we rolled it out amongst our first, second, and third year students. We had that student cohort of first, second, and third year students, making presentations and explaining to the entire university community how they actually benefited from going online. With the simulations that our ED is talking about and Dr. Beukes-Amis is talking about is exactly what we employed at that time. Those students could literally do, through simulations, they could do, for example, resuscitation, and they could practice that. They would be in a hospital, but they could communicate with their lecturers. And they could administer patients. And the collaborative learning, the interaction amongst the students, from the students with their lecturers, it was such a valuable learning experience for them that they were actually more engaged in their studies than, just sitting in a face-to-face class. It's like one student put it, we have the door in the lab that we need to practice the resuscitation and other practicals. We are a group of 20 students. I can't even see, when the lecturer is explaining to us. But with the simulation app, I can go over it again and again, and I can liaise with my fellow students. So there's beautiful examples, success stories out there.
Thank you.
And this is not just done in Namibia, it's done worldwide. We can do it too, and we have done it already.
Thank you very much, Dr. Mowes. I have Dr. Kachitai here to answer the health questions. One around the 3NDF Air Wing who was suspected to be quarantined at the Eros Airport, as well as that the 7 people who are showing symptoms, have they been tested, and will this test be available? Dr. Kachitai.
Yeah. Good morning. Thank you for giving me this opportunity to respond on behalf of the Ministry of Health and Social Services. The two questions are almost similar. It's just one concern. But just allow me to maybe start off with what the ministry is really doing. The way our strategy of actually dealing with this condition is really to make sure that we limit the individuals who pose a risk of actually spreading this disease. And that's the reason why we have actually started coming up with quarantine measures for those who are coming from countries which are really having a heavy burden of this condition. We all know. Initially we thought that it's China. China have most probably managed to deal with their pandemic, but at the moment they've actually been coming from Europe. So if you are coming from a country with a relatively high burden, and unfortunately, it's also the same thing. It also relates to South Africa as well, because the numbers of people who have been coming from South Africa the numbers of those affected in South Africa have also been rising. So what we say is, we either taking two strategies of either quarantining them, or we tell them to go on self-isolation at home, depending on what their home circumstances are. And that's basically through that we are making sure that we really decrease the pool of individuals who can actually pose an infectious risk to the people here. And the other issues are obviously the issues of actually preventing, making sure that if you are sick, that you don't, if you have got a feeling that you are sick, that you don't really go and pose a risk to other people, and obviously the normal things. But now coming back to the health professionals or even coming back to the professionals at immigration or whoever is actually have got to do duties. And all of a sudden we think that you have actually been in contact or being exposed to someone who's a potential carrier of this condition. We obviously taking the right measures of actually bring these individuals in. We subject them to testing if we think that the risk is actually relatively high. So obviously, if there are an NDF people who have, through the time when they were doing duty, they were also exposed. They will obviously be so that is that. But for the time being, as I'm having the information, we don't know, we are not aware of any individuals from the NDF who have actually been put under isolation or under quarantine.
Okay.
As far as the people who have actually been in quarantine, yes, some of them have got some natural conditions. I mean, some of them are having diseases. Sometimes some of those conditions can actually flick up. They can actually start developing symptoms. And clearly in the setting where we are dealing with the problem of COVID, we're taking those symptoms very serious. And if they need to be taken to hospital, or if they need to be taken to a facility where they can either be isolated or taken care of, we are doing that. And they are also receiving the testing, because these are the people with a very high risk of actually having COVID. So the tests are actually being done depending on the individuals. I'm not aware of the 7. There are some individuals who have actually been taken in receiving treatment. Some of them have actually been tested, but again, it's a confidential thing. We cannot just disclose this thing in the public, but I can only say that some of those tests have been done. So far, those who have actually been thought to be having a problem have actually been negative. But as I say, that information have most probably been revealed to them by their healthcare takers.
All right. Thank you very much. Are there any other questions on the floor? Unfortunately, we're running out of time, so I'll have one by one. The panelists, Dr. Kachitai, are still here. They're not going anywhere. Sir, the opportunity is yours.
Yes, Gordon Joseph from the NBC. My first question is for Dr. Catherine Beukes-Amis. If there's one thing that this crisis highlighted, is that vast inequality exists in all spheres of life. And we know that many students last year and this year haven't even received their 3G and 4G devices for this academic year, and that the challenges exist, such as internet connectivity and support at home. What practical measures have been put in place to assist those students who have fallen behind or who haven't accessed any online teaching yet, and so on? And then the second question is to both the representative from UNAM and NUST. What are the financial implications for the students that are either unwilling or unable to do any kind of online teaching? Because some students are arguing there's a reason that they enrolled for contact practical classes in urban areas because of the resources that are available in more urban areas like Windhoek and so on. So what are the financial implications for those students? And the same in the financial implications for the students, postgraduate students that are doing master's courses, where among the research methods, they've consciously chosen to do research ways that require things like focus group discussions and so on. So what's the financial implications in that regard? And to Mr. Van Kent, in terms of private institutions, what measures is in place to ensure quality assurance at private institutions during these very uncertain times? Thank you.
Thank you very much. As you respond to the questions, please also just say your 30-second last words as we round up this discussion.
Okay, yes, Joseph, product of the University of Namibia, proudly so, and one of my students in particular as well. Yes, we have had problems with some students that did not receive their 3G devices or their 4G devices, but we have been dispatching those as we speak throughout the country, and we are communicating to our student community that they can collect these at their nearest teller shop, because we really want them to get access to these, whether it's the actual 4G dongle, the pocket Wi-Fi dongle, or it's the actual SIM card loaded with 10 gigabyte of data. I think it's also important, Edie, that we mention the fact that through the social responsibility of our operators, they have also basically played their role by making sure that we could offer 10 gig of data per month for our students and not just 5 gig of data. So these are all measures that we have put practically in place to reach our students and to make sure that they will access. Also, don't forget that I have indicated a while ago that our students can also use the SIM cards in their mobile phones and then make the mobile phone a hotspot in order for them to be able to use their laptops or other devices that they will use to access their learning and teaching activities. So, yes, indeed, we are thinking about all of this. We have put various flexible measures in place. It is a promise from the University of Namibia that if we have evidence of students that were falling through the wayside or through the cracks during this time, that alternative measures will be put in place once the situation normalizes. But that's if the situation normalizes. If it doesn't, it means we have to continue collectively to find solutions of how we can pick up the pieces. It's important that we also indicate that the statistic that Nanso shared about the 40% that was raised here before has since increased tremendously. As we speak, the University of Namibia on Moodle has got over 23,000 full-time students online. We have got over 8,000 distance mode students online, and we've got over 10,000 online students online. Now don't get confused with the total figures, because collectively you will tell me that doesn't add, Doc, because you have only 28,000 plus students in total. It's because we allow our students to study through a flexible mode. You can be a full-time student, but also have modules on distance or online mode. Yes, my final message would be, even for postgraduate students, this is a time that we have to do things differently. We have to shift some of our meetings, online, our seminars with focus groups and things like that. Our facilitation of this learning, our supervision will have to go online as well. Certainly at UNAM, we have been working with our Center for Postgraduate Studies to equally, get onto this bandwagon with us. So I'm going to end by saying, this is our hands collectively as higher education institutions. Let us be on the front line, students and staff. Place your hands in our hands and let us make online learning a success. There is certainly no going back.
Right.
I thank you.
Thank you very much, Dr. Dr. Mowes, you can use one of the mics on the table just to answer the question, but also your final words. It's on.
Okay, thank you so much, Honorable. From those, the question with regard to students who are unable or unwilling to continue because they don't want to opt for the online mode. We have also we have a lot of resources for our students to give them the necessary orientation how to go about to study online, because we understand that there's fear. So our first approach would be to avail that to them and see whether they will still, keep to their decision, no, this is not for them. I must say, and for our student community out there, that tomorrow we will have a senior management meeting again at NUST. And all these aspects is already part of our recommendations put forward by our NUST COVID Academic Planning Committee, so that we can make final decisions tomorrow as part of the NUST senior management. And then we will make, definite decisions and communicate that to our student community. Okay. My final statement with regard to the current situation that we are in, it's an extraordinary situation. It requires extraordinary measures that we need to take place. All key stakeholders in education, from universities working together, our support that we have received from government so far all these years. A lot of investment has been made through our Namibian Open Learning Network, as well as through our universities. It's time that we capitalize absolutely on those resources and investments that our government has made. I just want to say finally, as Namibia, we cannot operate in isolation. We have international and regional protocols that we need to adhere to. The AU agenda is there that we need to adhere to, the Sustainable Development Goals, our own national strategic initiatives. We need to take hands. We need to stand together. We can do this.
Thank you very much, Doctor. Dr. Van Ken, just 30 seconds.
Thank you. I'll be very fast.
Okay.
The issue of inequalities is a reality, even during face-to-face. And it is important that we should identify the challenges of students. Our partners like NUST, they need to assist us in identifying those challenges, and we need to collectively come up with solutions. As a ministry, we are available to come in where we are needed, and I agree with my fellow panelists that this is an emergency, we need to work together to come through this emergency. And it's also an opportunity. Thank you very much.
Thank you very much, Dr. Van Ken. Thank you very much, all of you, for coming to join us this morning as we discuss higher education amid COVID-19 in Namibia. Please join us again, viewers, this afternoon at 4 p.m. as we continue the discussion around higher education. We'll be joined by panelists from private institutions of higher learning, from the Namibia Training Authority, as well as from the students' representative, NUST, so that we continue the discussion. So thank you very much for joining us. Keep on sending your questions to our email address, covid.nam@mict.gov.na, and we continue the conversation there. Thank you very much.